Hi, I'm Dr. Mirrafati. So we're continuing the series of breast educational video. The next topic I'm covering is, does breast lift look weird at first? Well, yes, it does. It really does look weird. And we have patients, right now, I don't even show the patient what it looks like in 24 hours. When you do a breast augmentation with implant, you come in, I put a mirror up and say, hey, look at how gorgeous it looks. With breast lift, I really don't want to show it because it looks like a Frankenstein. The nipples all like mutilated, and the scars on the thing on the bottom, it looks sort of weird. And then the top, sometimes they look top heavy. If you're doing it with implant might push up and the bottom is hollow. So there's a lot of factor to this, but I always tell patients it will be okay, because breast lift, remember, you're pulling from multiple angles. You're pulling the nipple areola higher, and medial laterally you're bringing it together. Then on the bottom of the breast, you're either cutting it or just bringing it up. So those are all factors that you're moving the breast in multiple different layers: up, medial, lateral, bottom, and then putting an implant if you're doing it together. Now there's some doctors, they don't do their lift with implant. I do. I think if you can keep the vasculature, it's pretty safe to do, and knock on wood, we haven't had any problem with that. But either way, with breast lift, you can also always have a little bit of necrosis on the bottom where that vertical incision hits the bottom on that triangle. But it will all heal and fine. And I tell patients it takes about 3 to 6 months for everything to look normal. The breast sort of falls low and it looks natural. It is very highly satisfied by the patient at the end, but at the beginning they do panic a little bit. So I'm giving you a heads up, don't panic. It looks a little bit weird at the beginning, but it will always, and especially sometimes it look asymmetrical. One looks a little bit often than the other, but if it's done by proper surgeon beforehand, they measure everything, make sure everything is okay, because once you're in an operating room, you can't just guesstimate. You have to go by the original drawing and the measurement and a half. Often when I'm doing a breast lift, it takes me a whole 45 minutes just to draw it out before surgery. So sometimes an hour, I draw it out, I measure. As we stated in carpentry, basically measure twice, cut once. So you want to keep measuring this side versus that side to make sure that they're both are symmetrical, because during the surgery, even though you can argue, well, I set them up, I brought the bed up and I saw it, I think it's best to do a preoperative drawing pretty well, and then that way you don't have to guess during the surgery. So don't panic if you just got your breast lift done. It will come together and it will be okay.